So I guess I wanted to start by asking, what are the biggest challenges that the Native Women's Shelter faces trying to provide shelter and resources for First Nations and Inuit women and children during the pandemic?
I mean, it's been incredibly difficult since the beginning, right? So when you think of best practices for shelters, none existed. Everything had to be created on the spot. And I remember seeing lots of emails and communications going out trying to figure out, well, what do you do? And we really we had ideas like at the beginning, we decided to have two sets of staff. One set that was administrative and frontline that would come into the office, and the other set of staff, we would pay them to stay home and be healthy. And if anyone got sick, then we would remove the sick staff and bring in the healthy staff. But what happened in the middle of May is that 7 of our staff got sick, so we had to close down, right? So even though the first group of staff started to get sick, even though we started to replace them, they still got sick immediately. And we had to reach out to public health and the CUS, letting them know, listen, like I did not want to close down. We have never closed down. But, you know, we didn't have the resources. So I remember reaching out to the CUS and to public health and asking them, why don't you send us like people that are, like the army. The army was in, Montreal not too long ago. Thank you. Why don't you send us, different workers that would come in so at least the women could stay safe, but we could continue operations while this, could we get cleaning products? Can we get, best practices? Can we get something? And everything was turned down. And because I also I manage Resilience Montreal. I ended up spending most of my time at Resilience because I was afraid that I was going to get COVID and bring it into the building. But one of the social workers, Emily Brutton, who was a CS social worker designated to work at Resilience, she was like, "Listen, you know what? My boss can help you." So even though the head of the CUS was not willing to help us, someone a little bit lower down said that they would help us, and they found an external women's a hotel run by SOS Violence Conjugale, where we could send all the women and children directly there. And they all got tested, and we moved in and did it immediately, because even when we approached the CUS with this sort of plan B, they were like, no, no, I don't think that's a good idea. We were like, thank you for your advice. We're going to do it anyways. And we moved out. And that gave us time to let all the sick staff, get healthy. It gave us 2 weeks to completely revamp the shelter. And we brought in the Architecture Sans Frontières because they have a mandate on making shelters COVID safe. And they came in and they helped us with, different plexiglasses and, different spaces. I mean, we already had some stuff, but not enough. And they talked about, where there were certain rooms that were sort of like hot zones, that, this is a place where a lot of the staff got sick. So I had to change this space around, and even creating almost a triage with all our floors. So, we have 13 bedrooms here. So each floor has different bedrooms. We designated one floor just for brand new people that were sort of like in a zone where it's sort of questionable to see whether or not they would have symptoms. And then after 2 weeks of no symptoms, then they would be moved to the next level so that new people would go in. And since that happened, we reopened in June 1st. Things have been okay, but we are super careful. We have cleaners that are here 5 days a week. I mean, we're always wearing masks. We have, as soon as anyone walks in, they have to immediately wash their hands. Like my colleague just said me, everything is like on paper and plastic, and right, like we are going completely by the book and ensuring that we keep everything safe. So the women that come, it's kind of like a weird time because it's almost Christmas, so people are trying to figure out whether or not they're staying here or if they're going home, or it's not good to travel or whatever. So, we continue to just monitor, people's temperature when they come in. And again, we also have the Architecture Sans Frontières that comes in probably every 2 months to reevaluate the space and to make sure that things are moving well, or flowing well. That we haven't had any cases since, and we keep in contact with public health to sort of update them. So yeah, it's been challenging, and especially now because as we see in Montreal, every day the numbers are going up. So we are still being very vigilant because we've already lived through worst case scenario, and the thing is that with the first wave, there were a lot of homeless hotels. That all stopped as of the end of August, right? Now they have one hotel where you can have 200 to 300 people stay at the Place du Puy, but it's not for our clientele, right? It's for, like, they like coming here. It's cozy bedrooms, and it's home cooked meals, and spaces for children to play, and specialized staff to work with, like we have a family care worker, an addictions worker, a clinical supervisor. We have, our elders coming back in January. And we also have a psychologist who's doing all the sessions by phone right now. But, they have all these things. They don't provide that at this homeless hotel. So I don't know. That's a lot. I don't know if you have other questions.
When you do have someone who wants to use the shelter and they have a high temperature rate or they're displaying signs of COVID, what do you recommend for them? Where can they stay?
Well, we have sort of a policy, right? So, in terms of if someone has a fever, we immediately have them go and get tested before they come in. If we start to see that there's, temperatures that are higher, they have symptoms, like there's literally a protocol where, a bunch of questions are asked to each individual person about their health status, and then we keep on top of it, right? We sort of watch them to see if anything develops, but we have a contact, and we try when we can to actually escort them, to bring them to these places they're getting tested or whatever, right? So I mean, yeah, as the resources in Montreal keep changing, we sort of keep up to date with where the appropriate place is. Because at one point it was like the Hotel Dieu, but I'm not sure. I'm not sure which is the place that all that information is with the staff. you know, they have all those protocols there, so I can't tell you offhand. I could go and get the paper and read it to you, but rather
No
not
problem.
right
Um, so considering homelessness has doubled from around 3,000 to 6,000 during the pandemic, are you seeing a growth in the amount of Nations and Inuit, possibly in particular women and children, who are maybe becoming homeless during the pandemic?
I think this is probably a better question for resilience. I run resilience, but I don't work there.
Mhm.
Um, they are serving 900 meals a day, and they're seeing an increase of people coming in. Um, we do right now at the Native Women's Shelter. We do have quite a few mothers with children that are staying with us. So yes, the people that we already know are continuing to show up. But a lot of the times it's also for the respite care. You go into a shelter and you know that you can, uh, have all these, complementary services, and you're in crisis. This is the place to be. So, but we do have like a family care worker, and she seems to be very busy because, this is also a time of year where a lot of children are sort of where youth protection is called a lot. Um, so, I mean, we're pretty much full. Sometimes it's weird. It's like sometimes we have like a waiting list to come in, and then other times it's really quiet. So it sort of comes in waves, and I think people are trying to make plans to return to their communities, but it's also everything changes so quickly, right? Like the numbers, in Nunavut are rising for COVID when before there was like, maybe one, maybe, right? So going back may not be the thing to do. So we're just here to sort of support them as best we can, and to also prepare for, the upcoming holidays, and make sure that, this is a festive place to be, right? We're going
Mhm.
to decorate the shelter, we're getting everyone gifts, or, like we go over and above to, spoil them. So yeah, that's the next plan, to see those that are, like, it's a really difficult time across, everyone's having a difficult time, but, being away from your family, is really hard during the holidays as well. So
Absolutely.
looking to, prepare for that.
I'm not sure if this is something you would feel comfortable talking about because it is a bit of a difficult issue. But, during COVID, we're seeing kind of higher rates of, sexual violence, domestic violence, stuff like that. Is this something that maybe you're seeing more intensified within people who are coming to the Native Women's Shelter?
Um, that's a better question for resilience, because they
Okay.
see what literally happens is people get assaulted and they come through the doors, and it's not like we have a they have a more open door policy where anyone can come in at any particular time. We don't have that policy. If you want to come in, you have to call first. We have to sort of ask you the questions. You have to be like, there's a lot more. So that's a better question for them. But I know that that is definitely on the rise.
Okay. Okay. Thank you. And I just wanted to ask, considering rising rent prices, rent evictions, and the low vacancy rate kind of combined with layoffs in the pandemic, are you noticing that this is really affecting the homeless situation in Montreal?
Well, we're definitely seeing the numbers rise, right?
Mhm.
We're definitely seeing that people that, can't afford, to pay for their apartments. We really need to have more subsidized housing. We need to have, like, the Native Women's Shelter, we're opening a second stage housing, but because of COVID, it's gone, it's another year that it's going to open. And we were supposed to open in 2021. Now we're going to open in 2022. So, like, the need is there.
Mhm.
And it would be nice if, the government was able to, sort of, you know, commit to that, right? So at Cabot Square, you have these multi-million-dollar condos, right? Like, I don't know, maybe you should have done something more about social housing than, they gave a tiny little portion to, like, the elderly, and some, but like maybe 5 or 6 like units or something like that. It's not enough. Um, and people are really suffering right now. So I think that, yeah, more needs to be done, and needs to be done quicker, because what happens is that tragedy, when a tragedy strikes, that's when the government starts changing their tune. So why wait for a tragedy? Why not do it right now? Why don't you see the numbers that are rising? Why don't you sort of listen to, what is going on in the community, and make those appropriate changes? Like the Native Women's Shelter, we 10 years ago we planned to have this second stage housing. It's a long time coming, but you need to things need to be done in a way where you find a building that is in an area where people would actually use it. So if you're going to put it in, like, Timbuktu, it's not appropriate. No one's going to go there. So this place is like literally 3 blocks away from us. It's downtown where the people are. It's downtown where, if you have, families that are with, youth protection and Batshaw, that they can easily come and go and not have to spend 2 hours on a bus or metro or whatever to get to their appointments. Schools are around here. This is a place that, Indigenous people are in the city. There's some kind of stat where it's like close to, like, over 30,000 Indigenous people living in the city. And that took 10 years to happen, right? So, because we're just a nonprofit. But if you're in a position of power of the city, and you see that these abandoned buildings, continue, especially now during COVID, there are all these buildings that are empty, trying to turn them into either more community centers or shelters, or, even if it's just temporary shelters to help the people. Because, like you said, the numbers, you're something at 6,000. Well, opening a hotel for 300 people, that's still an enormous amount of people that aren't getting services. You have these other little shelters that are opening, but it's only for maybe 18 beds in this place, and maybe, another 20 in this place, but that's still nothing. 900 people come through resilience, but we have to build the place that it's COVID friendly or safe, and we can only fit 60 people in the building, but we're serving 900. So people have to come in through the courtyard into the building, get their food, get their clothes, and get out the door so we can send in the stream of other people that are waiting. And in the courtyard, we took one of those sort of like carports and, got some heaters, and people are sitting outside to keep warm. It works for today, but when it's minus 30, where are people going to go? So that is always my concern. What is going to happen? And there's where the tragedy happens. And that's when people move into action. And I'm like, stop. I've given you 100 million ideas. Like, please do it now. So we wait, right?
Um, just backtracking to housing for a second, would you say that in Montreal, systemic racism plays a role in Indigenous folks not having access to permanent housing?
Absolutely. But we've always seen that, right? So I have been working at the Native Women's Shelter for 21 years now, and in different roles. I've been the executive director since 2004, so maybe whatever, 15, 16, whatever years. Um, when I was an outreach worker, I used to bring women to apartments, and the landlords would say flat out, "Oh, I don't rent to you Inuits. You're all a bunch of drunks." Right in front of me, in front of my Inuk client, and I would have to make complaints and try to bolster the self-esteem of the woman I'm sitting with. So yeah, systemic racism is everywhere. It's in youth protection, it's in the police force, but it's also for people trying to find housing, which is why, what is the solution? You build it yourself. We're going to open 23 units, of a beautiful building that's fully furnished, and we're going to have the Dr. Julian Foundation, because social pediatrics is the way to go, since youth protection still isn't addressing the Viens Commission and the recommendations. I know that the Laurent Commission just put out a statement, this week, talking about the fact that Indigenous people are overrepresented and are not being served properly. Like, everyone knows this, but no one's doing anything. So you have to build it yourself, right? And you hope that maybe you can be sort of a leader in terms of the behavior, and others will follow. But you need to do it now, right? You need to do it in this generation. Like, I mean, anyway.
When you say 23 units for the new housing, would this be able to hold 23 different families?
Yeah.
Okay, great.
So some families and some single women. So it all depends on, let's say if a woman comes in, she has 3 children, she'll get a unit. So we have all different, sizes. And that's gonna, we literally break ground in April, because now everything's starting to freeze over. We have architects and everything, we have funding. So things are slated for April 1st, and there'll be big announcements and all that in a press conference. And yeah, so we'll have like a supportive housing. So it's not just apartments, but it's someone who actually runs the second stage housing 5 days a week. And we have all the complementary services that we have here. So once a day we'll have the sort of addictions worker, and then we'll have the psychologist come by, and our art therapist come by on another day. So every day people can come downstairs and see, oh, there's a sign up sheet and so is coming here. And we also design the space so that the main floor, it'll have the Dr. Julian Foundation in one part of the main floor, which means that people from outside can use our services. If they're having troubles with youth protection, they can come to us and we will help them. But also having like a larger space where we can have like, motivational speakers come in, or someone come in with, preparing CVs or education or ceremonies, right? We're building it in a way where we can have, like burn sage and not be rained on, right? So, right, we're going to have a garden that's outside. We're going to have a large kitchen, even though every single apartment would be fully furnished with kitchens and all that, we're still going to have a giant kitchen so that we, as a group, let's say Christmas comes around, everyone can come downstairs and share a meal together, right? And that was something that the architects were kind of like, what are you doing? Like, we never heard of this. I'm like, well, because it's an Indigenous way So let's go get with it. Anyway,
This is really good to hear about this initiative. I wish you guys
yeah,
good luck with
it's
it.
exciting.
And just last, I wanted to ask, I know you really explained a lot about it, but is there anything else that you want to see the City of Montreal improve on in order to help provide resources and housing for homeless Indigenous folks?
Um, it's a kind of a hard question because right now it's hard to look too much into the future when we're in the middle of a second wave, right? What are we going to do now when the cold weather shows up? Um, and I've said this many times that if you look at the past and you look at when people were sick, I often think about when people had tuberculosis. Look it up. They have these pictures of everyone like on these lawn chairs with thick blankets outside. They made everyone go outside. They're like, this is the way to heal. Okay, so if people actually did that, can we do that now? Because there's nowhere for people to go. So get the lawn chairs and the thick blankets, but get one of those big army tents and have it heated and give out food and do this in a way where a large group of people can rest, can be fed, and then you have some resource workers that can help you with whatever it is that you need in terms of getting ID or going to appointments or whatever. But that overflow, we're going to see the brunt of it fairly soon. And why not build something like that? If they did it during TB and it worked to get people out of, tuberculosis and all that, it's not the same thing with COVID, but it's a safe measure. And it can be done if you have the will. I don't know. It's like I said, I brought it up a couple of times. Um, and we'll see because I know like a lot of the places where the homeless people would go are not accessible to them any longer. So if you go to Cabot Square, there used to be an entrance into the metro. That has been blocked off since the beginning of COVID, and they have not opened that area. So that's where people would kind of just stand and not freeze to death. That's not an option. I walk through Bonaventure Metro, and all the seatings have the big yellow tape. You're not allowed to sit there. So the warm spaces that they used to be able to go are gone. You see people that are literally pushed out of other spaces. If you look like where the open door is now, like on Park Avenue, there was a large parking lot. And at the beginning of COVID, it was an empty parking lot. But a lot of people would congregate there. Well, not too long ago, they put up a big fence. So now they can't even use that. There was another space where a cafe, Press Cafe, had closed down for a long time, but the entrance had like a roof. So people would stay there to get out of the cold, snow, rain. That was blocked off too. I'm like, so people are literally in the streets. And, this summer we had two Inuit women that got hit by cars and died. You were literally being pushed into the streets. So, like, I don't want to wait for more, deaths. I don't want to wait for more, like do something better. Why would you, if no one is using an empty parking lot and they've found some kind of solace there, what's the problem? Really? But anyway, so I hope that they, continue to consult, but really consult. Sometimes they say they consult and it's sort of like, oh, by the way, we're doing this. That's not consultation. Really get some ideas and why I know that that they're trying to do better in terms of the city of Montreal having the reconciliation 5-year plan. That's really huge to have that, but needs to have timelines and concrete measures and do it immediately. You can still be that city that is, sort of avant-garde or, doing things that no one else is doing. Well, do that for the homeless too. Why not have Montreal be that place where that is the sort of epicenter of best practices? You have enough of the experts around the field to give you the advice. Start listening and start doing it. Otherwise, wait and see what happens. And I worry.